The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening, everyone, and welcome to another edition of the RX Question Lab. I'm your host, Jeff Downing, and tonight, very happy to have you with us as we embark on a journey to enhance our ability to tackle some board-style questions that focus on biochem. So if it's been a while, if you're trying to dust off some of your biochem brain cells, or if you're getting ready to take biochem, hopefully we'll have some tips, some tricks, and some guidance to help you through it. You know, trying to prep for your subject exams and USMLE exams, it's challenging. A lot of this is kind of, it tests our limits, and that's why we're here. Going to help you navigate these waters, no matter how turbulent. We do believe that answering, board style questions is one of the highest yield activities that you can engage in while studying. And while they can sometimes seem insurmountable, I think we can do it. So our mission here is to help you develop some of the necessary skills to, effectively slice and dice these questions, do it effectively, do it efficiently. And we're going to just talk through how you break down some of these questions in real time. Hopefully you'll get a chance to ask questions along the way and incorporate our techniques into your study routine. So again, we're focusing on biochem tonight. I am flying solo. I've got Kate in the background here answering questions. So if you do have questions, head on over to the question box. Otherwise, grab your notes and open your minds. Let's get ready for a productive session. I will say, hey, you've met us. We'd like to learn a little bit about who is with us tonight. So I'm going to launch the first poll. And this is going to be the easiest question, the slam dunk of the night. Who are you? We have any M1s, M2s, M3s, M4s out there, IMGs, FMGs. Let us know. We typically wait until about 2/3 of you have voted before we close the polls and share the results. So go ahead and let us know who's out here with us tonight. For those of you in the U.S., which is where I'm based, I'm here in St. Louis, Missouri. Kate is down in North Texas, and we've been just blistered by the heat. So hopefully you guys have a cool place to participate tonight and sharpen your biochem skills. Well, with that, let's go ahead and close the poll. About 3/4 of you have voted, and share the results. So we've got a healthy IMG contingent, which is pretty normal here for Question Lab. We also have a number of M2s in the crowd, some M3s and M4s, and even a few M1s. And that doesn't surprise me. I wouldn't be surprised to see some M1s here, especially if that's one of your first blocks, or if you've got a block coming up that tackles this. Either way, we're glad you're all here, and we look forward to a good session here tonight. We started Question Lab over 3 years ago, near the beginning of the pandemic. And what we do is we follow the methodology that we developed with RX Coach so that we could help everybody learn how to create a good method for answering questions. So we're going to be following some of those RX Coach mandates tonight, and our hope is that they're helpful for you. But the main thing is that we just really want you to have a methodology going into test day, right? Uh, you know, you basically, the way you train, the way you study, it really pays off if you're doing things in a specific, efficient manner. So you don't even have to think about it, that you're tackling questions the same way every time, and you can really just focus all of your brain cells on getting that question right. So with that, let's go ahead and start with question number 1. When I open this up, you're going to see that there's something missing, right? And what's missing are the answer choices. And we do this by design. We really, feel like it's important that you focus on the question. Sometimes there are, uh, you know, there are concepts or things within the answer choices that might throw you off your game, especially if you see a term or something that you're either unfamiliar with or that has given you trouble in the past. Um, our point here is that you should be going through these methodically and taking it one step at a time. So what we say is, first step, cover up those answer choices. Second step, read the lead-in. And the lead-in is the actual question. So in this case, the lead-in is intake of which of the following amino acids should be restricted in this patient. So you start there. Sometimes what we find is that the question itself is answerable without even going to the vignette. Now that's very rare, I think, in step 1. But I think the important point here is that what kind of data you're looking for. If you go and read the vignette first, you're taking in this big story, and then you get to the question. You're like, oh shoot, what was I? I should have been looking for this, or oh, now I have to rescan the vignette. So you start with the vignette. Now we go back to the vignette, or I'm sorry, you start with a lead-in, then you go back to the vignette and read that. A 7-day-old male is brought to his pediatrician because of lethargy, vomiting, and difficulty feeding. On physical examination, he is difficult to arouse, does not respond to stimulation, and has poor muscle tone. He is admitted to the hospital because of failure to thrive. Shortly after admission, the infant has a seizure. A biochemistry evaluation of urine shows ketoaciduria. Lymphocyte analysis shows deficiency in alpha keto acid dehydrogenase. So again, intake of which of the following amino acids should be restricted in this patient. Okay, so think about this. We often ask how many steps it would take to solve this. You can let us, let us know in the question box. What we're going to do is we're going to just kind of highlight some of the areas that that we think are important within the vignette. 7-day-old male, that is key information. Understanding that you've got practically a neonate here. You've got lethargy, you've got vomiting, you've got difficulty feeding. It's difficult to arouse, doesn't respond to stimulation, poor muscle tone, failure to thrive. So a lot of these important findings follow a very specific line of thought, right? And the evaluation of urine shows ketoaciduria, and the analysis of his lymphocytes show deficiency in alpha keto acid dehydrogenase. Okay, so with that, let's go ahead and look at the answer choices. And what we do is we read the answer choices from bottom to top. And we do that because, sometimes especially on test day or when you feel like you are time constrained, you may land on an answer choice and say, oh, that's probably the one. That's the one. Oh, that seems familiar. We say read them from bottom to top, just so that you're thorough, right? So the answer choices here: E, tryptophan; D, phenylalanine; C, lysine; B, leucine, and A, alanine. So what I'm going to do is I am going to launch the poll, and I would like you to let us know intake of which of those amino acids should be restricted in this patient. Go ahead and tell us what you think. Yeah, we've got some, hopefully we've got some good questions. You know, last week, for those of you who joined, or not last week, 2 weeks ago, we did some HEMOC questions. Good session. And crowd did really well. I think we were 4 for 4. So we set a high bar. I will say that we've got some challenging questions here tonight, and I know biochem is always challenging. So I'm not blind to that. So I'm be interesting to see how we do. Got a lot of I'd say maybe 3 questions here on with pediatric patients involved. So should be interesting. Okay, we've got 3/4 of you have voted, so I'm going to go ahead and close the poll. And let's share the results. So kind of a 2-horse race. 39% of you thought leucine, 35% thought phenylalanine. Number of you also thought about alanine. Only a few of you went with lysine, and some of you went with tryptophan. Okay, very interesting. Let's go ahead and hide the results, and we will reveal the answer. And the answer is indeed answer choice B, leucine. So nice work. We're going to take that as a win. And let's talk about this one a little bit. Okay. So what's the obvious diagnosis here? Who wants to tell me in the question box what the diagnosis is for this young patient? Anybody? There we go. Joyce says maple syrup branch, maple syrup urine diseases, says Luke. Yep, that's right. So yeah, we've got a patient with maple syrup urine disease. It's an autosomal recessive metabolic disorder. It affects the breakdown of the branch chain amino acids, leucine, isoleucine, and valine. So again, these are considered branch chain because of their appearance. So in MSUD, you've got a deficiency in the enzyme complex branch chain alpha keto acid dehydrogenase, right? So this is responsible for the decarboxylation and subsequent metabolism of the alpha keto acids derived from the branch chain amino acids. So that deficiency, what does it lead to? It leads to an accumulation of alpha keto acids and branch chain amino acids in the blood. You've got elevation of these compounds in the urine, which leads to the ketoaciduria. We saw that, right? And then there are neurotoxic effects on the brain. So that's what's producing some of these symptoms, the lethargy, the poor feeding, the vomiting, the poor muscle tone, and the seizures. So often these appear within the first week of life, right? So that's a good trigger for you when you see that, and you see those symptoms, right? Failure to thrive, lethargy, vomiting, seizures. Now, and in some cases, there's like this characteristic maple syrup odor to the urine, which gives the disease its name, though it's not always present. And I think in this question, that would be kind of a giveaway, right? I think so. So in terms of the diagnosis, you got your the biochemical analysis of the blood and urine for elevated levels of BCAAs and alpha keto acids. and then genetic testing to confirm the specific mutation. So, in this disorder, the dietary management is going to be crucial. The intake of the branched chain amino acids, it's got to be restricted. It's got to be monitored closely. And you're going to have some medical interventions like IV fluids and glucose and fat administration. Those might all be necessary. Maybe even a liver transplant for severe cases. So, obviously in this case, the symptoms along with the ketoaciduria and the deficiency in the alpha keto acid dehydrogenase really pointed towards maple syrup urine disease. And since leucine is one of those branched chain amino acids, restricting its intake would definitely be a part of the dietary management. So, in terms of the, our other answer choices here, typically, like I say, we usually go from bottom to top, but I'll just walk through it here. So alanine, it doesn't cause a known metabolic defect of alanine catabolism. Lysine, tryptophan, those are not catabolized by alpha keto acid dehydrogenase and would not lead to increased alpha keto acids in the blood. And then phenylalanine, which is what got a lot of votes here, it is involved in phenylketonuria, but it's caused by a decrease in phenylalanine hydroxylase or a decrease in the cofactor BH4. So again, in this case, the symptoms, really kind of suggest another cause. Okay, so tell you what, you guys did really well. This is a good start for the evening, and let's see if we can carry it forward into question number 2. Okay, so once again, we've got those answer choices covered up. And you can see in this one we've got some lab values for you, so stay sharp. Again, let's read the lead-in. Which of the following acute metabolic processes most likely induced this patient's current condition? Okay. So we know we're going to be choosing from some acute metabolic processes. So let's see that if we can highlight some of the key data within the vignette. A 55-year-old man is brought to the emergency department because of nausea, vomiting, abdominal pain, and altered mental status. He reports recent binge drinking after being fired from his job 2 days ago. His medical history includes hypertension and chronic alcohol overuse. He is afebrile, but tachycardic and tachypneic. Abdominal examination reveals diffuse tenderness. And you could take a look at the lab studies. You can see the sodium levels, potassium, chloride, bicarbonate, glucose, lactate. And we do have the normal range for the lactate. So again, which of the following acute metabolic processes most likely induced this patient's current condition? So again, we've highlighted a few of the key clues, I'd say, within the vignette. I'd say 55-year-old man should also probably be highlighted. Brought to the emergency department. I think where the patient's admitted is also helpful. But also look at his tachycardic, tachypneic, and then definitely look at those lab studies. Okay, so now what I'm going to do is I am going to go through the answer options. And we're going to go from bottom to top. Answer choice E, thiamine deficiency. D, overproduction of NADH. C, inappropriate induction of gluconeogenesis. B, elevated pyruvate levels, or A, decreased levels of glycerol 3-phosphate? Okay, so again, your question here is, which of those acute metabolic processes most likely induce this patient's current condition? Okay, so go ahead, take your pick, and we'll see how you do. We also like to remind you that on test day, you should never leave a question unanswered. It is not going to, it's not going to harm you. You're not going to lose points on step one by answering incorrectly. So you always want to make sure you take a shot. Let's see, we've got about half of you have voted. Let's go ahead. Let's get everyone else in here. Even if you're a little bit shaky on it, that's okay. Okay, let's see. Almost 3/4 of you voted. So let's go ahead and I'm going to close the poll. And I'm going to share the results. Okay, so 4 of the answer choices got double digits, at least in terms of percentages. So overproduction of NADH was the leading vote getter. Thiamine deficiency was on its heels, 28%. And then inappropriate induction of gluconeogenesis and elevated pyruvate levels, kind of battling for third place. Okay, very interesting. Let's go ahead, hide the results, and reveal the answer. And the answer is answer choice D, overproduction of NADH. That is excellent. You guys did it again. We are 2 for 2. Nice work. If you didn't get it right, that's okay. That's why we're here. If you're going to get the question wrong, get it wrong during question lab and not on step one. So let's go ahead and walk through this one here. So what have we got here? Well, this one really ties together some of the concepts of metabolism, chronic alcohol overuse, and some of the basic principles of emergency medicine, right? So we've got a 55-year-old man presents the ED with nausea, vomiting, abdominal pain, and altered mental status after a recent binge. So we need to think about, well, what are the underlying metabolic processes at play here? So if you think about how alcohol is metabolized, you've got ethanol is converted to acetaldehyde by alcohol dehydrogenase, and you got NAD plus is reduced to NADH. Then acetaldehyde is further converted to acetate with a second conversion of NAD plus to NADH. So what happens when there's an increase in NADH, especially in a chronic alcoholic, right? I see a question here saying that it didn't say he was chronic. It does say, it says his medical history includes hypertension and chronic alcohol overuse. So that definitely something to pay heed to. So again, what happens? The overproduction of NADH is going to lead to some pretty key changes, right? You've got the pyruvate, it's diverted to lactate. This leads to lactic acidosis. Acetyl-CoA is shifted into ketone body production, so that causes ketoacidosis. And then the gluconeogenesis is inhibited, which results in hypoglycemia. So let's connect these metabolic disturbances to this patient, right? So we've got, what do we got? We've got nausea. We've got vomiting. We've got abdominal pain due to GI irritation, and we've got altered mental status from hypoglycemia and acidosis. So In this one, you really have to look at the labs. And I didn't highlight the labs. I think that whenever you see labs on a step question, they're all going to be important, either to point out something that's out of range or something that you can rule out. But in this case, here's the story they tell, right? So the low glucose levels from inhibited gluconeogenesis. You see the high lactate levels, so that shows the shift from pyruvate. And then you've got these the low bicarbonate levels reflecting metabolic acidosis. So the most likely acute metabolic process inducing this patient's condition is going to be the overproduction of NADH, and that's kind of integrates the clinical and lab findings into a coherent diagnosis of alcoholic ketoacidosis. So again, just a case where kind of illustrating how chronic alcohol overuse leads to these major metabolic disturbances manifesting in pretty severe clinical symptoms. So if you can understand these underlying metabolic pathways, you can diagnose and manage these cases, no matter how complex, right? So let's look at the other answer choices. Thiamine deficiency, it can cause lactic acidosis because thiamine is a cofactor for the pyruvate dehydrogenase complex. However, it wouldn't cause hypoglycemia. And then, for the other answer choices, you've got, you have to just keep in mind that, alcoholic lactic acidosis, it doesn't cause decreased levels of glycerol 3-phosphate or elevated pyruvate levels or an inappropriate induction of gluconeogenesis. Actually, pyruvate is shunted into the lactic acid pathway in alcoholic acidosis, and that causes increased levels of glycerol 3-phosphate, low pyruvate levels, and inhibition of gluconeogenesis. So, good job, everyone. I know that some of these are complicated. If you're like, oh gosh, I really need to kind of bone up on biochem. We actually have something I'm going to share with you at the end of the evening, so make sure you stick around. We're going to do a giveaway as well, so make sure that you are here for the raffle. And we're going to move on to question number 3. I hope everyone is hanging in there, and appreciate all of the questions and comments coming in through the question box. Happy that this is making sense for everyone. So let's go ahead and go to question number 3. Again, we've got the answer choices covered up, and we're going to start with the lead-in. A deficiency in which of the following biochemicals characterizes the most likely diagnosis in this patient? A deficiency in which of the following biochemicals characterizes the most likely diagnosis in this patient? Okay, so again, you're kind of looking at that. That looks like a classic 2-step question, right? You're going to have to figure out the diagnosis, and then what biochemical is helping to characterize that, or a deficiency in which of these selected biochemicals it's characterizing. Okay. So with that, let's go ahead and read the vignette. Again, we've got a young one. A 4-day-old newborn boy is brought to the ED by his parents immediately after he sustained a seizure. The parents report that their son has had a weak cry, difficulty feeding, and a few episodes of vomiting. The infant's delivery was uncomplicated. Physical examination shows low muscle tone and an enlarged liver. So here we've got the serum studies. So you can look at the bicarbonate levels, the anion gap, glucose, the propionic fatty acids increased, odd chain fatty acids increased, and methylmalonic acid is undetectable. So a deficiency in which of the following biochemicals characterizes the most likely diagnosis in this patient? Okay, so if we first off, kind of looking at some of the key information, uh, there's a lot here that I think you would, you should just jump off the page for you, right? 4-day-old newborn boy. Always thinking about the age, especially for newborns. Um, you see delivered to the ED, you see that he's had a seizure, weak cry, difficulty feeding, few episodes of vomiting. So again, we had a different type of case earlier, but again, you've got low muscle tone, you've got an enlarged liver, and some key serum studies. So with that, let's go ahead and look at our answer choices. So let's read them from bottom to top. Answer choice E, propionyl CoA carboxylase. Answer choice D, methylmalonyl CoA mutase. C, medium chain acyl CoA dehydrogenase. B, carnitine. And A, acetyl CoA dehydrogenase. Okay, so what we're going to do is we're going to open up the poll, and I want you to let us know what you think is the correct answer here. Fire away. I know this is kind of a tough one, so I don't know. We'll see if we can maintain our winning streak. But of course, the key thing for us here is learning. So while we love to go 4 for 4, we're better off if we can uncover a knowledge gap or a clinical reasoning gap that we can close here. Okay. Let's see, about 2/3 of you have voted. I'll give you a few more seconds. It's an interesting set of answer choices here. We do have a clear leader, but we've got 3 that are really battling. So let's go ahead and I'm going to close that poll. Let's share the results. So 2 out of 5 of you went with answer choice E, propionyl CoA carboxylase. And then, answer choices C and D kind of battling for the second position. Okay, well, let's go ahead, hide the results, and reveal the answer. And the answer choice is E, propionyl CoA carboxylase. Great job. Nice work, everybody. And again, about 60% of you missed this one, so that's okay. We're going to try to work through it, and we're going to do that right now. So, here we are with a question that really gets into the world of inborn errors of metabolism. So, what have we got here? We've got that 4-day-old newborn boy experiencing seizures, weak cry, difficulty feeding, vomiting, low muscle tone, and an enlarged liver. So here, really the lab findings are going to provide the key insights into the diagnosis. First, I think it's important to recognize that, the body breaks down proteins and odd chain fatty acids into, intermediates like propionyl CoA. The enzyme, it's vital here. Well, if you look at the enzyme like propionyl CoA carboxylase is the vital one. It's converting propionyl CoA to methylmalonyl CoA. What happens when that enzyme is deficient? Think about that. Let me know. In the absence of propionyl CoA carboxylase, the propionyl CoA, it accumulates, and then it's converted into propionic acid and other derivatives. And so this leads to an increase in propionic and odd chain fatty acids. Now, how does that connect to this boy's clinical presentation? Well, first you've got, the symptoms, right? The weak cry, difficulty feeding, vomiting, seizures, low muscle tone, enlarged liver. These are all classic manifestations of propionic acidemia, and that's an inborn metabolic disorder caused by the deficiency in propionyl CoA carboxylase. Now, let's look at those lab findings. And look at the serum studies. So you've got the bicarbonate slightly low, so that reflects mild metabolic acidosis. The anion gap is elevated. Glucose normal, but propionic fatty acids and odd chain fatty acids are increased, while methylmalonic acid is undetectable. So that's the kind of pattern that points to to the diagnosis. So in this case, the correct answer is E, propionyl CoA carboxylase. The enzyme's deficiency really, it characterizes the most likely diagnosis in the patient. It's a good, example of how that biochem understanding can get to the clinical diagnosis. In terms of the other answer choices, the incorrect answers, let's go from the bottom here. So the deficiency of methylmalonyl CoA mutase is associated with increased methylmalonic acid in normal propionic acid levels. Deficiency of peroxisomal biogenesis factor 1, that's going to lead to fatty acid accumulation and consequent hepatic dysfunction, profound hypotonia, and difficulty feeding. But propionic acid and methylmalonic acid would be normal. Okay. The carnitine deficiency would result in the toxic accumulation of long-chain fatty acids, and deficiency of acetyl CoA dehydrogenase results in the accumulation of fatty acyl CoA, and both of these would cause a ketotic hypoglycemic state. And then the medium chain acyl CoA dehydrogenase deficiency results in elevated levels of odd and even medium chain fatty acids, and that causes hypoglycemia after fasting. Okay, so hopefully if you struggled with that one, some of this is coming through. There's a lot to be thinking about, though, obviously, with understanding all of the interplay between the actions and reactions. So good job, everybody. And we're going to go into our final question. And I'm sorry, looks like someone's internet died and then finally came back on. So luckily, we post our Question Lab episodes on YouTube and on Facebook. So you can always tune back in or watch the recording later this week. Okay, final question here. We've got the question or the answer choices covered up. And we're going to start with the lead-in. So which of the following biochemical deficiencies characterizes the most likely diagnosis in this patient? Okay. So again, looking for biochemical deficiencies. We've got some similar questions here tonight. Again, we've got another pediatric patient. So let's read the vignette. An 18-month-old girl is evaluated for respiratory and feeding difficulties. She has had difficulty lifting objects and pointing. On examination, poor muscular tone and a systolic murmur at the left sternum are noted. Eye examination is normal. Fasting blood glucose level is 100. Pathologic examination of a skeletal muscle biopsy sample shows periodic acid shift positive material within vacuoles. So, which of the following biochemical deficiencies characterizes the most likely diagnosis in this patient? And again, we've highlighted a few of the items, obviously, or bolded a couple things here. 18-month-old girl, respiratory and feeding difficulties. I think all of the exam findings here are important. Difficulty lifting, difficulty pointing, poor muscular tone, systolic murmur, the fasting blood glucose level, and you've got the results from the muscle biopsy. Okay, so with that, let's go ahead and look at the answer choices. And going from the bottom, so answer choice E, lysosomal acid alpha glucosidase deficiency. Answer choice D, glycogen phosphorylase deficiency. C, glucose 6 phosphatase deficiency. B, galactose 1 phosphate uridylyl deficiency. And answer choice A, alpha 1 6 glucosidase deficiency. Giving myself all kinds of tongue twisters here tonight. Okay, with that, let's go ahead and launch the poll. Again, this is our final question of the night, so go ahead and take your best shot. And we'll review the results momentarily. Okay, looks like about this one's taking a little bit more time. About half of you have voted, so maybe a few more seconds. Okay, about 3/4 of you voted. So let's go ahead and we're gonna get ready to close the poll and share the results. Okay, so almost half of you with answer choice E, lysosomal acid alpha glucosidase deficiency, GAA deficiency. And kind of a battle between three of these answers for second place, but pretty clear favorite here. So let's go ahead, hide the results, and share the answer. And the answer choice is E, lysosomal acid alpha glucosidase GAA deficiency. Well done, folks. You did it again. 4 for 4. That's an impressive outing, especially for Biochem. So nice work. Didn't get it right. That's okay. That's why we're here. So let's break this one down. And I would love it if folks could head over to the question box and let us know what your diagnosis is. So again, we've got an 18-month-old girl presenting with respiratory and feeding difficulties. Got poor muscular tone, systolic murmur, specific findings on a skeletal muscle biopsy showing periodic acid shift, PAS, positive material within vacuoles. So what are these features consistent with? Okay, I see a couple of folks have weighed in. Yeah, Pompe disease. That's right. These features are consistent with Pompe disease. So, Pompe disease, also known as glycogen storage disease type 2, this is an autosomal recessive disorder caused by deficiency in lysosomal acid alpha glucosidase, or GAA. Now, this enzyme is responsible for breaking down glycogen into glucose within the lysosomes. So, when this enzyme is deficient, glycogen accumulates within the lysosomes, particularly in the muscles, and this leads to some of these symptoms that 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 she presented with. So it's kind of it's a complex clinical picture. Glycogen is the storage form of glucose, right? Its breakdown and synthesis are really tightly regulated. So in some conditions, these processes go awry, and that leads to these glycogen storage diseases. So, in Pompe, the deficiency is in the lysosomal acid alpha glucosidase, um, and the role of that enzyme is to break down glycogen within the lysosomes. So, what happens? You get this accumulation within the lysosomes, particularly in the muscles, and it leads to what? Leads to the respiratory difficulties due to diaphragmatic weakness. You got feeding difficulties, poor muscle tone. You got a heart murmur, and that reflects possible cardiomyopathy. Now the labs here I think interesting, right? You've got the skeletal muscle biopsy shows PAS positive material within the vacuoles, and that's a classic sign of glycogen accumulation in lysosomes. So that histological finding really helps confirm the diagnosis. Anyway, so again, that deficiency really kind of characterizes this diagnosis. And if you can recognize these signs and symptoms and interpret these biopsy findings, you're going to be able to get straight to the conclusion. In terms of the other answer choices, okay. Well, let me just say, yeah. So for the glucose 6-phosphatase deficiency, that's common with that equates with von Guericke disease, and that presents with severe fasting, hypoglycemia, and hepatomegaly. Alpha-1 6-glucosidase deficiency, as in Cori disease. I know someone mentioned Cori earlier. That's characterized by stunted growth, hepatomegaly, and mild hypoglycemia. Galactose 1 phosphate uridyl transferase deficiency. Oh my gosh, I cannot pronounce that. That results in galactosemia, and it manifests with infantile cataracts, hepatosplenomegaly, jaundice, failure to thrive, and intellectual disability. So again, if you recall, she's her eye exam was normal, right? And then glycogen phosphorylase deficiency, that's what you see in myocardial disease, and that presents with painful muscle cramps and myoglobinuria with strenuous exercise, which is often connected with older children. Okay, so thank you everybody for hanging in there. I hope that this has been a good session. I'm putting up all of the question IDs so that you can review them on your own. So take a screenshot or write them down. Nice thing about popping these into Qmax is that you can see not only all of the explanations and the various first aid facts connected with the question, but also relevant bricks and flash facts and express videos. So